After several weeks of a decline, Governor Beshear is saying Kentucky is in an escalation of COVID-19.
The Commonwealth is seeing the highest numbers for new cases of COVID in 9 weeks. As Chad Hedrick explains, hospitals are not overrun yet, but the state is ready to act should they find themselves in a situation that they just got a break from.
With less than 3 weeks until families have their long-awaited Christmas get-togethers, a Grinch, by way of COVID-19, is looking to make a comeback.
We are back in an escalation.
New cases have reached a 9-week high in Kentucky, the national daily average topping 100,000 for the first time in 2 months. Hospitalizations are also ticking up before they reached their pre-fall surge lowest.
The curve is, again, not quite as steep yet as the last escalation, but remember, we didn't reach our floor again. We didn't get all the way back down.
Governor Beshear says hospitals are not sounding the alarm yet, but his administration is ready to act should hospitals start to become overwhelmed.
So one of the lessons learned is knowing when to ultimately turn on some of the assistance levels. We've seen the National Guard, and what a huge help they are.
The state is working to connect hospitals with nursing programs to quickly bring in students should staff become stretched thin again. They're also making sure lower-level hospitals are ready to expand ICU units.
And certainly there's a hope because either people getting boosted or who have just had it hopefully will have higher levels of immunity, at least against Delta, that we won't go as high as fast.
The added concern, though, is that this increase is happening around the holidays and when people are inside and closer together. But the potential ramifications are still too early to determine.
We're going to have to wait and watch and see.
In Frankfort, Chad Hedrick for the Fox 56 10 o'clock news.